Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. SHAHZAD. Today we will discuss a very common topic, that is hypothyroidism, which is routinely missed by the clinicians. And though the patient is suffering much more, and she should be diagnosed earlier to relieve her agony. So hypothyroidism means that is the thyroxine, which is a thyroid hormone, is low. The thyroid hormone is working low. So when this hormone will be low, the condition is called hypothyroidism. This thyroxine is in a concern related for the metabolism in the body. Metabolism means that by the energy is produced, and that energy is consumed by doing different processes in the cells in the body. So if there is no energy, then the processes will not be maintained, and there will be the complications. So to maintain the homeostasis of the body, regulating the body, that is heat, fluid electrolytes, and all other functions, those need energy, and that energy comes from through the metabolism. And heat also is a byproduct of this combustion of this metabolism, which maintains the body temperature. So this means that if the body temperature is not maintained in a certain range, the cells cannot function, and there can be irreversible damage. And you might have heard that there was high grade fever and there was brain damage. So it means that in every situation, the body should maintain its temperature in a certain range, and the functions of the kidney, liver, brain, everything that is maintained by the energy, and that energy comes from the metabolism, and mostly the glucose metabolism. And although there are fat and protein also, so current energy comes from this glucose, and then the reserve carbohydrates, and then if there is starvation, of course, from the fat as well, and at the last the protein is used. So the relating to the metabolism, that is the hormone is thyroxine, which comes from the thyroid hormone, which is in front of the neck. And normally this thyroid is not seen, not large, but due to iodine deficiency, there is a goiter or multinuclear goiter, and toxic or benign. So this gland may be enlarged, and that looks ugly and disturb the function of the body. And this thyroxine, which is produced by the thyroid gland, it is T4 and T3. T4 is converted into T3 in the periphery, and that T3 is the active form that works and handles the metabolism. So this is regulated by this hypothalamus, pituitary, and the thyroid gland. From the hypothalamus, hormone comes, that is thyroid releasing hormone, and that acts on the pituitary. From the pituitary, thyroid stimulating hormone comes, and that thyroid stimulating hormone acts on through receptors on the thyroid gland, and thyroxine is produced. And if there is less thyroxine in the circulation, more TSH will come. And if there is more thyroxine in the circulation, the thyroid stimulating hormone will be reduced. So if there is any damage, that is, a gland is damaged, or the pituitary is affected, and the thyroxine production may become low. And if there is thyroid stimulating hormone is deficient, and then again the production may be low. So the hypothyroidism may be caused by the destruction of the thyroid gland tissue, by the surgery or by any disease, or there is less amount of thyroid stimulating hormone coming from the pituitary. So then again this. So by when we this press test the T3, T4, and TSH and thyroid scan, it will conclude what is the problem, where is the problem. So by doing this, we can know where is the problem, and is it solvable or not, and what should be the treatment recommended. So in pregnancy, hypothyroidism, the patient is taking thyroxine. During pregnancy, this thyroxine dose is increased because the brain of the fetus, which is early dependent on the mother, it is developed by under the effect of thyroxine. If there is low thyroxine, brain will not be developed, and it will be there may be a permanent damage. So when the female is pregnant, if she was taking thyroxine, and that is usually the levothyroxine, that the dose has to be increased. So the better it is a due to the clinician or the family physician to concentrate on these things, and if he has got some clues or some suspicion of being hypothyroidism, he may advise himself the test, or he may refer to the endocrinologist. So again, this is, although this is not very common, but it is there, and we usually miss this diagnosis, and we should consider it well in the anemic patients, in the fatigue, in the obesity, mixed edema, and these things which we can suspect that there may be hypothyroidism, and obesity is also there, and we should diagnose, or we should investigate it. And with this, thank you very much. Khuda Hafiz.